What is the best priority?
Okay.
Be a two-step. A 71-year-old female has sudden right-sided weakness and slurred speech.
Okay. Immediately, what does your brain start thinking?
Starts thinking stroke.
All right, we start thinking of a stroke. We don't know what kind yet. We don't know if it's ischemic or hemorrhagic, but let's keep going.
Last known well was 45 minutes ago.
Okay. That would be important. Why is that important?
Uh, you'd want to report the last known well time
Okay.
or normal.
Why do we care though? What's so special about the last known normal time compared to when the symptoms started? It's because we've got to get this patient, if we're going to get some kind of clot busting drug like TPA or something on board, we have to beat the 4.5 hour mark, because at the 4.5 hour mark, once there's cellular damage, that's where the neutrophils show up. They bring their enzyme with it, NADPH oxidase, that causes free radical damage, and it causes more, like eventually it's going to cause more damage that's going to ultimately result in like a scar. We're trying to beat the clock before all that other stuff starts happening. And that happens around the 4.5 hour mark. So we've got to get the TPA on board like in under 3 hours, in under 4 hours, if possible. That's where that window period comes from. Okay. So she's within the window period of 45 minutes. So that's good. Unless she has some other contraindication, she may be a candidate for some kind of clot busting drug. Blood pressure is
184/96.
okay.
Heart rate of 88.
Mm-hmm.
Respiratory rate of 18.
Okay.
SpO2 is
Okay.
97%.
So she is hypertensive. All right. That could definitely point to, especially like a hemorrhagic stroke. Blood glucose, we definitely check a blood sugar in every sign of altered mental status. Blood sugar in this case is, how would you describe it?
Normal
Blood sugar is fine. Okay. So
is good.
these symptoms are not due to hypoglycemia. Now, if they were due to hypoglycemia, then we would fix that first. But since the blood sugar is fine, we're going to say this is probably a stroke and not a hypoglycemic or diabetic event. What's my priority here?
For the stroke,
Yep.
um, you want to,
Let's start with D.
oh, sorry. Place the patient supine and wait for symptoms to improve.
Yes or no?
No, no.
No.
Perform a stroke scale, determine last known well, and rapidly transport to an appropriate stroke center. That sounds pretty good.
Okay. What about B?
Lower the blood pressure before transport? No.
No. Okay. And because
Give
that
oral.
that pressure may be the only thing keeping them alive. If we drop it too quickly, we may actually stop the perfusion to the brain. Keep going. And what about
Give
A?
give oral glucose because stroke mimics are common. They're not
They're
hypoglycemic.
not hypoglycemic. There's no indication for that. So this is a time-sensitive situation where we're going to get this patient right to a stroke center. And we need to go ahead and immediately call a stroke alert. And from the time that we arrive at the hospital, we want to be at the CT within 10 minutes. The sooner, the better. Ideally, we don't want to stop in the ER at all. We want to go from the ambulance bay directly to the CT scanner. Okay.